Hello, I'm Jeremy Fernandez. On this edition of The Virus, the US President Donald Trump leaves hospital and goes back to work just days after testing positive to COVID-19. Plus, restrictions in a number of European cities come back on as case numbers there continue to rise. But first, it seems Melbourne's roadmap out of lockdown may be delayed. There are warnings the city may struggle to lower its 14-day rolling average below 5 within the next couple of weeks.
When this target was first set, there were a number of us commenting that that would be very challenging to achieve, and it really comes down to the nature of the virus. We know that there still is going to be that probability of outbreaks and clusters and little chains of infection that would make obtaining that sort of, we're not expecting to see a sort of steady linear decline in numbers. And so this little day-on-day variation, as we get to small numbers, it becomes more apparent. It's why when we set national targets for coming out of the first lockdown, we made them generous enough to cope with little outbreaks.
Meanwhile, in New South Wales, there's anxiety that Sydney could be on the brink of another surge. Authorities are scrambling to find the sources of a number of mystery cases. The alarm was raised on Wednesday when health authorities confirmed 3 locally acquired coronavirus infections. That brought an end to 12 days of no community transmission.
In New South Wales, where we have an open economy, where people are getting about their business, where we're hosting major events, we absolutely need the community to be vigilant, but we also have to accept that there's always that element of risk, and there's always that element of risk that we need to manage.
In response, Queensland Premier gave her southern neighbours a deadline of today to find the sources of several mystery COVID-19 cases, saying it would otherwise push back the planned border reopening. That ultimatum has sparked an angry reaction from the New South Wales Health Minister, who's lashed out at Anastasia Palaszczuk, accusing her of playing political games and claiming he has evidence her decision to keep borders closed is based on politics and not public health.
This is a completely reprehensible, uncaring and cruel approach by the Queensland Premier. I haven't criticised any other Premier or any other Minister in the country during this because we've all worked together. Premier Palaszczuk, it's about time she woke up to the fact that politics and looking after patients and families don't mix. Just cut it out.
New South Wales health authorities are also warning that the number of infections in Greater Sydney is likely to rise. So far, there have been at least 8 locally acquired cases confirmed since Tuesday. It's now also emerged that a student at Macquarie University in Sydney's northwest tested positive for COVID-19, raising fears of yet another cluster.
It's a concern that we're having community transmission and the source is unknown. We do know that there was a sewage sample that tested positive about a week before the first cases appeared, which tells us that sampling the sewage is actually a good way of trying to get a head start on finding community transmission. It's been used around the world quite successfully. And I guess, we have to make sure that all efforts are made to trace all the contacts, to quarantine them, and to make sure that the cluster doesn't grow. From my understanding, there's some linkages, but not all of them are understood. And there's quite a geographic distribution across, suburbs like Camden, Liverpool, which are quite far apart really, even though they're both in southwestern Sydney, and Parramatta. Whether they're all from the same source or not, that's the first thing that needs to be ascertained. If they're all from the same source, then that makes it a bit easier, but it does tell you how quickly pandemic viruses can spread geographically in a city like Sydney.
This time last week, we were bringing you news that the US President Donald Trump had tested positive to COVID-19. Within 24 hours, he was admitted to the Walter Reed Military Hospital in what the White House insisted was a precautionary measure. He was given an experimental cocktail of drugs, which Mr Trump would later claim was a cure for COVID-19. It's a claim rejected by one of Australia's leading infectious diseases experts, Professor Robert Boy.
He's had treatments which are not within the realms of evidence base. They are not of certainty that they will actually make him better. And indeed, in the next few days, he's at real risk of deteriorating and needing hospital care. I suspect he's got steroid psychosis, which is that he's not in touch with reality because he's got steroids driving his emotions and his thoughts.
And that extraordinary week in the US took yet another turn today, with President Trump's doctor effectively clearing him to return to the campaign trail this weekend, just days after completing a course of treatment for COVID-19. The CEO of the US Studies Centre, Professor Simon Jackman, joined me earlier. Professor Simon Jackman, welcome to The Virus.
Good to be with you.
Now, this time last week, there were legitimate questions about whether Donald Trump would sufficiently recover before the election or even survive. Now it appears he's fighting fit. Have the events of the past week materially changed the campaign?
We're still assessing the impact of this on American public opinion. But the key thing, I think, for a lot of us, we're consuming the headlines about Trump, but behind the headlines, the chair of the Republican National Committee is tested positive. The chair of the Trump campaign has tested positive. The press secretary, 3 in the communications shop at the White House. The amount of disruption to the campaign and to the Trump administration is profound. And I think one of the things we're starting to see, and a lot of journalists covering the White House are starting to sort of make these connections in their reporting, is that this is having a material impact on the way Trump is conducting himself, both as president and as candidate at the moment, and perhaps accounts for some of the, more erratic back and forth, even by Donald Trump's standards, that we've seen on policy, whether to be in a debate or not.
Do you really think so? Because it's always a bit erratic, isn't it? It's always a bit kind of difficult to work out exactly where they're headed and what they're doing.
Well, that's right, but it seems even more so than usual. So in the last couple of days, Jeremy, we've had this amazing backflip, no way, shut down negotiations with Congress on a COVID relief package until after the election. Next morning, the stock market tanks 400, 500 points, quickly backflips on that. A guy who is trailing badly in the polls. Every rule of the political playbook says, of course you do a debate where 60 million people will be watching to try and, to restore some support in the polls. And Trump says no, if he can't do an in-person debate, he's not interested in a virtual debate with Joe Biden. Where's the political logic in that? And it's got a lot of people scratching their heads about what's coming out of this White House.
Strategy-wise, what is it he's trying to avoid there?
I don't know. I honestly don't know. Every rule says you do that. I think he wants to be in audiences. If I had to guess, what is it? Where he is in much more command of the situation. The second debate was going to be a town hall style, and maybe he just doesn't like that format, or he wants to be in person. He feels he is a poor performer, which frankly he is. You take Trump away from the crowd, he's not as dynamic a performer as when it's live on stage in front of an audience, as it were. Perhaps it's that, but just the political logic of it is the thing I'm struggling with, Jeremy.
From a policy point of view, should he be re-evaluating the impact of coronavirus in the United States, or would that just sort of damage his credibility even further?
The thing I'm looking at above all is the amount of runway that's left. Early voting has started in state after state after state. We're down to 3 weeks. I think the real question is anything going to make a difference at this point, given the momentous week we had? Now, at some point you'd say, yes, of course. Perhaps he could pull some voters back with an about face and on COVID and his approach to it. But by the time the policy rubber hit the road, as it were, on anything he might choose to do, we'd be, we're only 3 weeks away from an election, more or less. And so I fear that the ship has sailed. And that's reflected in a lot of the polling, Jeremy, where, we're at historically low levels of undecided voters this cycle. It suggests that people have made up their mind, and the events of the last week have probably only served to reinforce that to some extent.
You say the ship has sailed. Do you think Mike Pence in the vice presidential debate managed to sort of send a hook out and reel it back in a little bit?
I think that the one thing that is pretty clear, looking at Republicans on social media and elsewhere, is that a lot of them are going, wow, that's a candidate that probably would do better head-to-head against Biden than Donald Trump at the moment. Number one, and it was sort of a reminder of what a more conventional politics looks like from both Kamala Harris and from Vice President Pence. So I'm not sure it's going to move the needle too much. I'm not sure a lot of people condition their votes, particularly with these low levels undecided. And when Donald Trump is the top of the ticket, that's what it's going to be all about. And so I think Pence is sort of perhaps do no harm and perhaps do himself a favor, for his political future, perhaps not this election, but, 4 years from now, perhaps.
Donald Trump goes back to campaigning as early as tomorrow. He may still be infectious. So is that a good idea?
It's remarkable, isn't it? You look at the social distancing protocols and quarantine protocols here in Australia, for instance, and indeed the American government's own guidance on this. It's remarkable. The whole thing's remarkable. Let's just stipulate that from the outset, that a sitting president tests positive for the virus, and then a week later has presumably a clean bill of health and is out there back on the campaign trail. But the political prerogatives here are what's driving it. He remains the best show for the Republicans. He is the show. It is the Donald Trump show. And hold up in the White House, this far behind in the polls, if he does nothing, he knows he's going to lose. Their only shot is to put the president back out on the road doing what he does best, and that is those large in-person events. And the health consequences, I guess, are a risk, but the devil you know is that staying holed up in the White House for another week or 10 days or whatever it might be is certainly not going to move the polls.
More than a dozen people have now been arrested in this alleged plot to kidnap the Michigan governor, Gretchen Whitmer. Now, she has laid the blame at Donald Trump's feet, saying he's issued rallying cries to right-wing extremists. Is that fair, given that right-wing extremism sort of precedes Donald Trump's time as president?
Yes and no. There are some very Michigan-specific forces at play here. The governor, Whitmer, put the state into a pretty hard lockdown, as lockdowns go in the United States by American standards. It's a pretty tough one, and produced a ton of pushback inside the state. And just last week, in a very partisan decision, the Supreme Court of Michigan took a big step in saying that the governor had overstepped the mark. And so this is enormously controversial, some of the things that Whitmer was doing with lockdowns in her state. And so there was an element of this that was brewing in Michigan. The other thing that is sometimes still a surprise for many Australian listeners, the idea of Michigan, you think it's a blue state, upper Midwestern state, but there's a long history of militias, of alt-right mobilization in that state. It is a big rural state. We think of it as being dominated by Detroit, which it is in a sense, but Michigan is a big place with parts of it quite rural, where libertarian, alt-right, big Second Amendment culture once you get away from the cities of Michigan in particular. So there's a big Michigan-specific piece of this. On the other hand, I think it's no coincidence that, coming not soon after the remarks by Donald Trump the other day, and I think one of the lessons, and the governor drew attention to this, is that political leaders, the things they say have consequences. In this environment, there is an awful lot of cue taking and cue giving going on. People are paying attention to what their leaders are saying, and Donald Trump urged his followers to get into polling places and make sure that there isn't corruption or fraud happening. But he also told the Proud Boys to stand back and stand by. And the idea that something as prominent as that, the President of the United States uttering words like that, is not going to have a consequence. Of course it's going to have a consequence, particularly in the context we're in, and particularly once you embed it in the hotbed that actually has been Michigan through the COVID pandemic.
Now, Simon Jackman, I don't know about you, but every time I go out in a social setting, this question comes up: will Donald Trump win? I'm sure you've been asked that a million times as well. So how clear-cut is the answer for you?
If this were happening anything other than 4 years after 2016, it is not a close election. But there's the rub, Jeremy. Right now, every morning I get up and I run an algorithm that computes poll averages and then looks at how wrong the polls were at this same stage in the 2016 campaign. And in the 2016 campaign right now, this is right after the Access Hollywood tape dropped, where Donald Trump is openly boasting about sexual assault. And as it turned out, polls in the field at this point in 2016 were wrong, particularly in swing states. And it's just uncanny that Trump has had this astounding run of bad political news and luck and making his own luck, some of the choices he's made over the last week, of course. But he is at a point now where if the polls were as wrong as they were in 2016, he would actually still have a shot. And a better shot than I think a lot of people realize. And so it all comes down to that, Jeremy. Did the polling industry clean up its act between 2016 and 2020? If you think the answer is yes, or even halfway yes, then Biden's running away with this. If you think the answer is no, then this election is still, despite everything we're seeing in the media, this election is still a lot closer than you might think. And I wish I could be more definitive than that, but I am so burned by 2016. I continue to hedge in any prediction about the way this is shaping up.
Professor Simon Chapman, always good to talk to you. Thanks so much for joining us.
Thanks, Jeremy.
The World Health Organization has reported a record one-day increase in global coronavirus cases, with the total rising by almost 340,000. That's largely down to the surge in Europe, which recorded around 100,000 cases in a single day. In Germany, cases jumped by 40% in one day, putting health authorities on notice.
To sum up, the incidence of infection is increasing in almost all regions, and that worries me greatly.
The French government has ordered tighter restrictions in 4 more hotspot cities after finding more than 18,000 new cases in the past 2 days. In Spain, a court has overturned lockdown orders in the capital, Madrid, despite surging case numbers there. And Italy's daily case numbers are back up to April levels and rising. Restrictions are being lifted in Auckland to bring the city in line with the rest of New Zealand. On Thursday, the city moved to Alert Level 1, meaning there will be no 100-person limit on gatherings and no physical distancing rules in bars and restaurants. The Prime Minister Jacinda Ardern is confident the second wave of infections has been almost eliminated. Back home, the week saw the Morrison government hand down its COVID-delayed budget. It makes a few bold assumptions about how we'll move back to normality and how quickly a vaccine will be available.
A key assumption in the budget is that there's a population-wide vaccination program fully in place by late next year. That's much later than previously indicated by the federal government.
We will need vaccines, and there is hope that by the end of this year we may have a vaccine. There is hope.
But how realistic is it that we'll have an effective vaccine next year?
There's a very good chance that we will not have a vaccine by the end of next year available for all 25 million Australians.
Any jab may only have limited effectiveness.
It may be available for healthcare workers and carers at residential aged care facilities, but for the general public, it's unlikely.
Public health experts were hoping the budget would have a roadmap for a post-pandemic future.
The budget last night did not prepare Australia for the rest of this pandemic or pandemics in the future.
The budget also assumes there are no major coronavirus waves in Australia and that Victoria's restrictions resemble the rest of the country's by the end of the year. That's by no means a certainty.
We're doing everything we can to get these numbers down and to be able to keep them down and then move to a much better set of rules and find that COVID normal, so it's a COVID normal Christmas.
And that all state borders except for WA's would reopen by the end of the year. But with community transmission resurfacing in New South Wales, that too is up in the air.
We have to assume during the course of the pandemic that from time to time we're always going to have this. We're always going to have cases.
With no rule book for this pandemic, the unpredictable nature of COVID-19 means that these assumptions aren't much more than an educated guess on what might happen next. Sophie Scott, ABC News.
And that is this edition of The Virus. Thank you for your company. Don't forget you can stay up to date around the clock with the ABC iView app, along with ABC Listen and all our updates on social media around the clock. We'll see you again next time.